Here's an elderly man with abdominal pain, nausea, and vomiting. I can see air fluid levels on the upright film. By the way, every day when I'm reading plain films and doing fluoro, I'll get numerous films, portable supine film, rule out free air or bowel obstruction. But you need an upright or decubitus film if you're going to look for air fluid levels or free air. So here is his CT scan. He's got gas within a thick-walled gallbladder, which is adjacent to a thick-walled duodenum. He's got dilated small bowel. He's got collapsed distal small bowel and colon. And he's got this loop of bowel with an arrow on it, which is always a worrisome sign. And that was the point of obstruction. This is a big cholesterol gallstone. It can be difficult to recognize the stone. The stone is always a cholesterol gallstone. And it may have an adsorbed ring of calcium or may be adjacent to an enhanced segment of bowel wall. But that has the Wriggler's triad, the gallstone, the presence of gas in the biliary tree, and the bowel obstruction. Wriggler described that in the pre-CT era, which is pretty amazing to me since it's rare for me to be able to recognize Wriggler's triad on the plain films themselves, although it's a pretty easy CT diagnosis in most cases.